Dear friends, I am Professor Dr. Sarada Prasanna Swai, Director, Mental Health Institute, Center of Excellence, SCV Medical College, Cuttack. I will speak on the eve of World Mental Health Day, which is observed on the 10th October. Every year, 10th October is observed as World Mental Health Day to create awareness on mental health and to remove stigma on mental health. The objective of the World Mental Health Day is creating mental health awareness among all the stakeholders, including public, for a positive mental health well-being. And to work on the theme of the World Mental Health Day on every year to prioritize mental health in different spheres of human life, to care, to support and to make policy for persons with mental illness. This World Mental Health Day was first observed in 1948 by World Federation of Mental Health, and from that day every year on 10th October World Federation of Mental Health give a slogan to prioritize mental health among all the stakeholders. From one or two countries, now by 2024 it is already observed in 94 countries of the world. World Mental Health Day, which is observed on the 10th October, this year we have prioritized the mental health in the workplace. Why? Because the mental health of all the employees working in the any environment or any organization or any government sector or private sector or NGO sector, the mental health of the employees or the workforce has the highest priority, which is emphasized by the World Federation of Mental Health. Because of the mental health issues, every year there is cost of loss of around US dollar of 1 trillion in the productivity with 12 billion working days loss, which contributes to 30 to 40% of work productivity loss, which is because of the poor mental health condition in the workplace. So, what to be done to create the awareness? First is prioritizing the mental health in the workplace. That means creating a mental health well-being of all the employees. That means we have to create a mental health well-being or positive mental health well-being of all the employees working in the workplace or working in the organization. Simultaneously, there should be a reduction of workplace stress management, because all employees working in a workplace suffers from any kind of stress because of their personal, familial or their workplace life stress. So reduction in workplace stress and burnout is highest importance to increase the productivity of the employee in the workplace. Simultaneously, there should be supportive network among all the employees, because by supporting the network we will reduce the stress among the employees by creating a positive mental health well-being among all the employees. Then we have to, by doing this, we have to increase the productivity among all the employees. So prioritizing mental health of the individual is the highest importance in the workplace. First, we have to do the time-bound maintenance of work. That means everybody should be time-bound in the workplace. Then there should be flexible workplace arrangements taking into condition of the individual. Then encouraging the work-life balance, because individual's performance in the workplace depend upon his personal life, his family life and his life in the society or in the community. Then caring the mental health of the risk groups. Who are the risk groups? The risk groups are persons suffering from some minor mental health issues, persons having physical disability, pregnant mothers, lactating mothers, persons in severe stress because of some life events. So we have to give highest importance to the risk groups. Then access to the counseling service. Any organization, at any point of time, somebody has the stress because of his personal life or family life, and they should access to the counseling service in the organization, and there should be the professional counselor in the organization. Then the most important thing is to reduce the mental stress. Everybody should openly talk about the mental health issues of the individual. What are the factors that is responsible for influencing the individual productivity in the organization? Number one is potential ability to work safely. That means we have to explore, by reducing the mental stress, we have to explore the potential ability of a particular person in a particular sphere to work safely. We have to see the difficulty in retaining or gaining the work. We have to see how we will decrease the performance and the productivity. Then we have to see the substance use in the workplace, because by increasing use of substance use or by substance addiction, the performance of the individual employee decreases. Then we have to see the burnout and the adjustment issues in the workplace. And the classical example of burnout and adjustment issues were revealed at the time of COVID-19, where most of the employees of the organization has complained of the burnout and adjustment issues, which was intervened by the mental health professional at that point of time. Simultaneously, we have to see the anxiety, the depression, and other stress related factors which contributes for the negative mental health balance, and the presentism and absenteeism following the mental health issue. After the individual factors, we have to see what are the interpersonal relationships which are responsible for increasing the stress in the workplace. We have to see the understanding of the individual as a role in the employee. That means everybody in an organization, starting from the head of the organization to the all the employees of an organization, should understand their role. Then in the organization, we have to create a positive mental health atmosphere with others, and simultaneously we have to give importance prioritizing the emotional quotient and social quotient. Nowadays, many organizations are doing workshop on the EQ and SQ, because not only the IQ, which contributes for the positive mental health well-being of a person, but in addition to that, nowadays EQ and SQ contributes for the best mental health well-being, which has given highest importance to increase the productivity of the organization. In an organization, we have to see the positive mental health well-being of all the employees. So we have to see how somebody will prevent a future mental health issue. That's why we will intervene for positive mental health well-being of the organization or the community by advising them some positive factors. That means their personal good habits, meditation, their life events, all the factors we have to see. Then in the organization, we have to see the high risk intervention, the high risk groups. For example, somebody suffering from a mental health issue, somebody has some physical disability, somebody has some mental disability, somebody is a pregnant or lactating mother, or somebody has some deformity. This type of people, senior citizens working in a particular organization. So you have to see the who are the high risk groups. They require special intervention. Then ultimately, the high risk group is persons suffering from mental illness, working in a organization, but they are already recovered from mental illness, because they are the risk groups. So you have to give highest importance to increase the productivity of the organization. Then after individual intervention, we have to see the mass intervention in the workplace. In the mass intervention, we have to see the mental health promotion. Mental health promotion means how will you make positive mental health well-being of all individuals. Next, emotional intelligence training. That means we have to arrange the emotional intelligence. Nowadays, the stress and the suicide rate is very common among young adults and also in the adolescents. So we have to make the training programs to make the emotional intelligence strong for a particular person, how that he or she will contribute for the organization. Then the social activities. The social activities is highest contributor that how somebody will be maintain a positive mental health well-being. Then physical environment of the workplace we should create or we should do make a positive change. Then awareness on the mental illness and wellness, because so we have to see what is the time what or how somebody is suffering from wellness and illness, and how somebody is going from wellness to illness. We have to see the timeline. Similarly, the family mental health awareness. Unless and otherwise somebody is free from some mental stress in the family, he or she cannot contribute in the organization. So we have to see the family factors. Then in the all the organization we have to see how the Mental Health Care Act 2017 will be applicable to all the employees. Simultaneously, the persons or the women employees, how they are suffering from any harassment, either because of some physical harassment or sexual harassment, which is coming under POSH Act 2013. Both Mental Health Care Act 2017 and Post Act 2013 should be completely implemented in the all the organization. Then mental health hygiene. Mental health hygiene means how somebody will be positive mental health well-being. That means everybody has to communicate properly, everybody to take care of his mental health, everybody to be relaxed, everybody should practice recreation in between while he is working in the workplace, and the yoga, which is the part of Indian contribution to the world, should be practiced by everybody. Similarly, the meditation and spirituality, which is the highest contributor to the mental health well-being by the Indian community. All the things contribute for mental illness. Then we have to see who are the risk group and how will you intervene. Homeless, mentally ill are the highest risk groups to whom we have to take care. Second, persons with chronic medical conditions like persons suffering from HIV, persons with chronic diabetes or chronic hypertension or arthritis, or suffering from cancer like diseases, those who are chronic medical conditions. In 7 to 80% cases, all these chronic medical conditions are associated with some mental health issues. Then life events and family burden. Life event and family burden is the one of the most common contributor of mental stress in the life. They should be properly taken care of. Similarly, caring the disabled persons at home. For example, any mother or father is taking care of his disabled son or daughter. That means he or she has some mental health issue that should be addressed. Similarly, the marital discord and separation, which is very common nowadays because of changing lifestyle, so that should be taken care of. Then high risk jobs. Those who are doing the high risk job like healthcare professionals like doctors, nursing officers or other healthcare workers. Similarly, the police officers, army personnel and firearm workers, they are the high risk job, so they have the highest mental stress, and that should be always properly assessed and intervened. Similarly, the LGBTQ population or gender minority or persons suffering from gender dysphoria, they are also in the high risk groups. World Health Organization recommends the organizational intervention, the training for managers. Training for managers means those who are working as a individual manager for a particular workforce, they should be properly trained to detect who are the persons suffering from mental illness, or who are the persons are in the severe stress, or who are the persons are suffering burnout, so that intervention can be done at any point of time. Similarly, after assessing the mental health condition of all the employees, training of workers should be done to see who are suffering from stress or who have the burnout. Then recommendation for individual intervention, that means we should intervene individually. And simultaneously recommendation for workers with mental health condition. If somebody is suffering from mental health condition, we should take special measure for intervention of his mental health condition. Similarly, recommendation for gaining employment for the people living with mental health condition. Then lastly, I will tell the most important thing in the workplace is organizational psychosocial risk factor intervention. As you know, all the mental health issues are because of the biopsychosocial issues. The biological issues mostly we cannot change, so you have to intervene for the psychosocial factors which can modify or which can create a positive mental health well-being. Similarly, interventions for persons with poor mental health condition. Anybody having some mental health condition because of his genetic factors or because of his personal factors, that should be intervened. Then managing the training on the mental health issues by doing the continuous training or skill training, the workforce or the persons working in a organization will be trained to detect the others mental health condition. So training at regular interval on the mental health issues in all organization is highly important. Similarly, training of workers on the mental health literacy and awareness, including stigmatization, is very important. It reminds us that we should talk openly about the mental health issues. Similarly, we have to enhance the skill training for the employment. That means all the employees should have skill training, that how you will detect the mental health issues and how will you prevent the mental health issues. And lastly, the support workers with mental health distress or other mental health issues should be taken care of. Then lastly, what is the take-home message for the workplace mental health? First is promotion of the work-life balance. Next, we have to encourage the recreation and effective communication in the workplace. Then we have to connect face to face, because that will reduce the stigma and stress in the workplace. Then we have to socialize in the workplace and also in the outside, because what we are doing outside, that is also contribute our productivity or efficiency in the workplace. Next, we have to encourage the physical activities, because as you know, the physical health and mental health and the social health are the three dimensions for a well-being of a person. So by doing some physical activities, not only will you improve our physical health, simultaneously we will improve our mental health and social health, so that we will be maintain a positive or maintain a well-being. That means well-being of the individual will depend upon the physical activities. Similarly, in all the organization, some dedicated funds should be allocated for the mental health promotion, because in all organization now everybody has felt the value of mental health. So a dedicated fund should be there for training and to taken care of the mental health of all the employees, and dedicated resource allocation should be done for this purpose. That means for the positive mental health well-being. So friends, lastly I will tell, in this year prioritization of mental health in the workplace is justifiable in all angles, and we have to take care of the mental health issues of all the employees of the organization, so that all the workplace or the workforce, those who are working in the organization, will be productive, will be efficient, and will create a positive mental health atmosphere, so that our country will flourish as far as mental health is concerned. And the productivity, by increasing the productivity, will increase the productivity of the country, that will contribute ultimately to the GDP, and that will contribute to the productivity of all the employees, and indirectly to all the community and also all the citizens of the country. So 10th October is a memorizing day for all the stakeholders, and we should contribute to do something on this World Mental Health Day. Thank you.